Hey, and welcome to today's session. I'm a nurse and a trauma survivor and the founder of Rewire Therapy, and my name is Tanya. And today we're going to look at some different motions and movements that come up that you can tell are reminiscent of traumatic tissue memory. So when we use a certain form of therapy called authentic movement, we can tap into movements that are coming up in our bodies that are also finishing off movements. So there's also an element of SE and somatic experiencing therapy here when finishing off movements come up. And I know that sounds really complex, but I'll show you in a really simple way how trauma memory come up in the tissues and how that's expressed, and whether you're a survivor or a therapist or a practitioner, how to read that. So I myself survived sexual assault, and when I do authentic movement, there's certain movements and motions that come up automatically, and that's a result of tissue memory. So here are a few examples of motions and movements coming up in the body. And so even if somebody was unconscious during a trauma, or they were too young to remember a trauma, or it happened too long ago, or they were frozen and just blacked out or too drunk, there are still these similar movements that would come up, especially with sexual assault or violence or aggression. And so here's how you can read that in a person non-verbally. So the first movement that would come up tends to be a pushing away movement, or even kind of like a slapping away movement. So when the person is just honoring whatever body movements come up, they tap into their body, they have interoception, and they feel like their arms want to do something. Often what will come up is a sort of slapping or pushing movement. In terms of other forms of assault, especially with penetration, there would be a movement that would actually be pushing out, so going towards the pelvis and pushing away lower down near the pelvis. So that's an authentic movement that can come up, and also a finishing off movement that might come up in SE, somatic experiencing. So that pushing away movement. There's also when there's been aggression and violence in the past where the arms will come up and that movement will happen. So a protective movement where the person wanted to protect themselves, but either they were not able to for whatever reason under those circumstances. So that would be the third motion. And so today we've looked at a few different motions that when the survivor of assault or aggression will honor their body's movements, those different things would come up. A fourth movement would be even just the shaking of the head. That will come up very often as somebody doesn't want something to happen that is happening. And so to rehearse, the movements were a pushing or even a slapping away, the pushing towards and away from the pelvis, so protecting the pelvis movements, the shielding that might come up, and the turning of the head. And so we have four movements that often come up in terms of survivors and authentic movement and SE, two therapies that we've talked about today. I hope that helped you to understand how tissue memory expresses itself in the body through authentic movement and some somatic experiencing. And I welcome you to watch my other videos to learn a little bit more about trauma healing. Thank you so much and have a wonderful day.